Thank you for joining us to celebrate Nurse Practitioner Week. This session will answer the question, why should I become a nurse practitioner? I'm Dr. Lisa Chappell. I'm the Associate Dean of Family Nursing at Frontier Nursing University, and I've been a family nurse practitioner for 21 years. I'll be the moderator for the session. Maybe you're interested in becoming a nurse practitioner, or maybe you're a current student in a nurse practitioner program, and I hope we're able to answer any questions that you may have. We have two nurse practitioners on our panel. I'll introduce them. I'll give a short introduction for them, and then you'll learn more about them as they tell their stories. We have Dr. James Corder, who completed the Family Nurse Practitioner program at Frontier Nursing University in 2013 and the DNP program at Frontier in 2014. We also have Elena Pendergast, who completed the Family Nurse Practitioner program in 2016 at Frontier and will complete the DNP program also at Frontier in 2017. And thank you, James, and thank you, Elena, for taking time to be here with us today. Let's go ahead and take a look at some of the questions. The first question, what led you to make the decision to become a nurse practitioner? Elena, would you like to be first?
Oh, sure. My journey to become a nurse practitioner actually, as cliche as it sounds, is the same reason that I became a nurse, and that was really to make a difference. That journey kind of evolved over time. I had a mom who never graduated, not even entered into high school, and really had all these dreams for me to be a nurse because she had been like this, I call her the lay nurse of the neighborhood. But I kind of fought all of that until she got diagnosed with stage 4 melanoma, and I saw the impact that nurses made on people's lives, on their families' lives. You know, I was fortunate. I had a lot of mentors along the way, both physicians and nurses and other people in my life that just kept encouraging me to go back to school. But the same reason I didn't become a nurse earlier in my life is the same reason I didn't become a nurse practitioner. I was afraid, didn't think I could do it. Thought, you know, here I am, I'm 40 and I'm married and I'm a military spouse and I've got kids, and so I can't do this. But I became a nurse because I was angry about how my mom's death happened, and I wanted to make a difference. And I became a nurse practitioner the same reason. I was angry because I felt like nobody was doing what they could do. And I'm real passionate about end of life care. And I just got tired of seeing patients over and over and over. Just nobody was addressing the education needs. Nobody was taking care of them just because they had life-limiting or chronic illnesses. People just kind of, you know, were letting them fall through the cracks. And I was trying to set up a palliative care program at our hospital, and point blank got told, what's after your badge? And I said, RN. And they said, well, when you have something other than that, come talk to us. So now, hopefully, I'll have DNP after that.
So you really identified a huge need for nurse practitioner practice, improvement in medical care.
Absolutely.
Okay. James, how about you? What led you to become a nurse practitioner?
Well, some of the same things as Alana. The biggest thing with me, I would have to say, would be practice independence. I became frustrated with trying to paint a picture to providers about what I wanted, to add to a particular treatment plan, you know, for patients and things like that. And it's just so frustrating to me to see them take a different path than what I had painted for them. And so for me, it was more about practice independence.
Okay. And you know, you hit on a really great part about being a nurse practitioner, and that's autonomy in practice. The ability to educate our patients, to teach, to manage their care is a strong piece of being a nurse practitioner. Good. Did you find, and James, will you answer this first? Did you find your previous nursing experience to be helpful as a nurse practitioner student and as a graduate nurse practitioner?
I did. For me, my previous experience was in telemetry and ICU. I went straight out of straight out of nursing school into intensive care, and worked my way through that, and had a number of years in telemetry and in home health. And so then when I got ready to go to the clinical site, it took a lot of the fear out of what I might run into. I think that might become, might come before me. So yes, my previous RN experience was a big help for me as I entered clinicals in the nurse practitioner program.
Okay. Elena, how about you? Did your previous nursing experience help you as a student and as a graduate NP?
Absolutely. You'll have to excuse me, and you both can appreciate this. I'm in the midst of all of these tracers in the DNP program. So I was thinking about my career, and it almost seemed like one big tracer. It kind of, although not in this order, I hit it in the sense that our patient starts out at an FQHC, serving underserved populations and watching kind of how the beginning of the system, how difficult it is for the patient to get the healthcare that they need. And then, for whatever reason, they end up at a hospital, and they might have some kind of heart problem. They end up in interventional radiology, which is where I ended up, and we're diagnosing problems, we're trying to fix things. They end up on the floor. Med surge was kind of in that role for me, and that was a frustrating part because people are blaming the patient for being non-compliant, but I had already seen in the FQHC how difficult it was for them to get the care they needed. And then something goes wrong, they go to the ICU, and then someone figures out that they can't cure them, so they call the hospice. So I've kind of seen the whole entire cycle of healthcare, as far as that goes. And it was definitely very helpful for me to see all of those components when I went into clinical practice.
Mm-hmm. And you remind me of one of the strengths of being a nurse practitioner is that we do have that holistic knowledge of the patient, and we approach the patient, no matter why we're seeing them, in a more holistic manner, which gives us a really great opportunity to impact their health and to be able to teach them and know what their needs are. Yes. Also, it sounds to me like both of you found your previous nursing experience to be a strong foundation to build on in your education and advanced practice and in your practice as graduates.
Yes.
Some students worry about juggling school, work, and a home life. How did you manage this when you were a student? Elena, would you answer that first?
In my particular case, my husband and I sat down and discussed making some changes. I was able to switch departments. I was working med surge, which I found quite stressful, and decided to go to interventional radiology because it allowed me more flexibility. I chose a PRN position. And I was very fortunate. My director of my department supported. He knew I was going to school, and I worked with them, and they worked around my assignments. One thing I learned very, very early on in the program, and as I mentor students at Frontier, I always remind them, you have 11 weeks where your focus is school. Do not, as long as it's not a health hazard, whether your dishes are sitting in the dishwasher or the side of the sink or anything else really doesn't matter. Your children, as long as they go to school and nobody's calling DFAS on you, they'll survive. And it's a great opportunity to teach your children responsibility. My son started doing his own laundry. My daughters started helping out with things. And the other thing I tell people is recognize that this is an investment in your family. And because as women, we get so torn about being there for family and Little League and everything else. And, you know, technology is great. We can actually be there with iPads, join the soccer games and so many other things, but we can't try to take those 2 weeks off from school to try to fit in all the work shifts and all, you know, everything else. We just have to learn how to accept help, and we have to learn how to ask for help. Those are the two hardest things as nurses. I find that we're faulty at. We're great at helping everybody else. We're not so good at accepting help and, requesting it ourselves.
Very true. Very true. James, how about you? How did you manage your home and work and schoolwork all at the same time?
Well, just a little different spin than Atlanta. My children were grown, and I wouldn't recommend really putting off school that long. But I had that convenience that my children were already married, and I had grandchildren. So what I did is I needed to allot time for grandchildren. So what I've done is I allotted those times between terms. So I had the luxury of doing that as opposed to having to come home and cook and make sure they had clean clothes to wear to school and things like that. And the other thing that I thought was important for me is I kind of developed a plan each term. And I learned that some terms required a lot more time of study than others. And some of them I actually reduced my workload as far as my practice load while I was going to school.
Mm-hmm.
I'm sorry. If I might add one more thing, is that we need to remember that that 2 week break, and I know that you both have experienced this. Everybody wants to jump ahead, and I tell people, don't jump ahead. There's a reason that they schedule it 11 weeks. Take that 2 week break and cut yourself a break, So I agree with you, James, when you were saying about taking that time, that quality time for your family during that break.
Mm-hmm. I agree. And, I think as nurses, we think we can do everything at the same time,
yes.
But we don't have to. And the ability to say no, to really carve out those unnecessary things that you have in your life and focus on what is most important. Is it your family? Is it school? Is it work? And really be protective of your time and how you spend it. Good. Becoming a nurse practitioner can be life-changing. How did your professional life change while you were a student and after graduation? James?
Well, while I was a student, I began to notice in the practice as an RN setting that I began to look at patients more critically. I began to apply what I was learning in class to maybe their history and physical. And it caused me to be a better RN, even as a student nurse practitioner. And so then after I had finished school and I began to practice, after I'd been practicing a while, I noticed that other providers began to be more receptive of me and more interested in what I had to contribute maybe to the healthcare team or to their practice or to patient care in general.
Okay. And James, what's your current practice situation?
I'm a full-time provider in primary care, and I see patients from 2 weeks old to older adults, maybe in their 90s. And I see a variety of things. I do some women's health. I may do PAPs occasionally. I may have a 3-week-old baby whose mother's just worried about it, maybe that it's developing a cold. So it could be anything. I may have somebody come in with a chainsaw wound to the foot.
Mm-hmm.
Things like that.
And you're in rural Kentucky, is that right?
I am.
Gosh, interesting practice. Elena, how about you? How did your life change as a student and as a graduate?
I think because I came into nursing older, I always had that feeling that, oh boy, I'm behind the power curve here. But recently, anybody that knows me, they joke about me being the end of life midwife at Frontier, because palliative care and end of life you're going to hear about it from me. And I briefly mentioned earlier about the conversation about what's behind your badge. And about 2011, I had asked our CEO if he had seen the role of palliative care increasing at our facility. And he just point blank said, no. And so I recently had an opportunity to see, they had gathered, we have a regional burn center and we don't have a palliative care unit. And I've always been, an advocate for it. And we're at this meeting and they're discussing palliative care, and the speaker actually, because I was knowledgeable, assumed I was a physician. And so I'm sitting in this room and one of the physicians actually gave me his card, is speaking to me. And the next day when he called me, I thought that he was calling to kind of discuss with me, like coming and dealing with him. And actually I guess I didn't realize how much my role had changed from when I was a nurse to now, when he's actually asking me, he's pumping me for knowledge and information and expertise. So it was like the first time ever in my healthcare experience that someone was treating me like I was the expert in the field rather than they were. And that, it's like James said, that feeling of having that expertise, of having that independence, it was just very empowering, I have to say.
It sounds like you were both recognized by your colleagues and your peers of someone with great knowledge and expertise in patient care. Excellent. Excellent. Well, what advice would you give to someone who is trying to make the decision to become a nurse practitioner? James?
The first advice that I would give is not put it off a long time. I kind of made that mistake of putting off a long time. And what I will tell you is that there is never a good time to go back to school. Sure. There is never a perfect time to attend graduate school. So if you keep waiting and putting off till you find that perfect time, there's a good chance that you may not get to fulfill your life's dream of becoming a nurse practitioner. I think a good plan and planning for time, a good time, not a perfect time, but a time when that you can make it work. And do it.
Good. Elena?
I would say to somebody that nothing worth having comes easy. I agree with James about there's never a right time. I would say to them, search your heart. What moves you? If it makes you angry, if it makes you cry because you feel, just like you want to do something, if it moves you in any way, it's probably the thing that you're supposed to do. And if you're sitting here listening to this session, then we already know that you're moved just by the fact that you got moved to listen to it. I would say to them, like, deep down inside, you already know that you should become an NP because you're already exploring, and don't let your fear hold you back from accomplishing something that you might have been meant to do.
Good. Elena, what do you love most about being a nurse practitioner?
I actually told Dr. Marfell a little while back, I said that I had that aha moment. I had that, James, I think you spoke about it earlier. I always felt so frustrated as a nurse. I loved my patients, absolutely loved my patients, but I felt so like I wasn't in a position to do something. And I had that aha moment when I was a student. I was sitting in a room and there was a patient who had a problem with diabetes, and they'd gone through the regular counseling and, talking about drugs. And then as a student, I just thought, well, I'm just going to explain it this way. And I explained it the way I wanted to, not the way a handout told me to, not the way the physician told me to, not the way someone told me it had to be explained. I related to the patient one-on-one and did it my way. And that patient, just the light bulb went on, and they were like, I get it. I understand why this is important. And that moment for me was my big light bulb moment, because I realized you have this power. You can, you can influence someone's healthcare. You can influence somebody's life, in that room. That's where I would say I love being in the room.
Mm-hmm. Great. James, what do you love most about being a nurse practitioner?
Like Elena, I really enjoy practice. I really enjoy the clinical environment. I love being able to go in and do a full history and physical on a patient and develop a plan of care for them without having to go and ask somebody if it's okay or if this makes sense to them, unless I really need something. If I need something from a specialty practice, then I can determine if I need to refer this patient when they need to go. I've seen providers maybe have patients to come back to see them at times whenever I thought they might have should have been referred on to a specialty. Just for an example, that's the biggest thing for me. I would have to say independent practice, the ability to go in and see the patient and give them the treatment that they deserve.
Absolutely. It is very empowering, and the influence you have over your patient's life is awesome and humbling.
Yes.
Good. Would you like to add anything else? Have any other advice or guidance for someone who's considering this?
Like I said, I don't think anything, people are counting the cost financially, with time, it's an investment. And then just like investing money, investing anything else, it's going to take time. It's going to take money, but it's personally, professionally, but most importantly to our patients, it is so worth it. I think that as nurse practitioners, we have distinguished ourselves. I'm sure all of us have heard from patients who say, I love going to my nurse practitioner. They listen to me. And I think that training in nursing makes us ideal to take care of our patients holistically, to listen to them, to think through critically, and to do it in such a humble way. I think because we never started out thinking, oh, we're the top of the food chain. I think that as we get more education and experience, we never lose that humility that comes with being just kind of an advocate and I guess I would say a servant to our patients, not in a negative connotation, but to serve them, to take care of them and not our needs.
Excellent. James, anything you'd like to add?
The only thing that I would add is that for me, it was a lot of work. Going to an NP program was the hardest thing that I ever did. But from the other side of that, I am so happy that I made that choice.
Great. Well, thank you both for spending time with us today and letting us hear your stories and what your lives are like as nurse practitioners. To the listeners, I hope you found this helpful. Thank you for listening to our recording, and we would love to see you at Frontier Nursing University. Thank you.
Thank you.